So thank you so much for the invitation to speak at this conference. Today I'll be providing a brief overview of the Lung Cancer Policy Network and our latest work on optimising lung cancer diagnosis. So just to quickly introduce myself, my name's Jessica Hooper. I'm a senior researcher at the Health Policy Partnership, which is a specialist health policy research organisation based in the UK. The Health Policy Partnership provides the secretariat to the Lung Cancer Policy Network, and I'm here today as a representative of the network's secretariat team. So the network is a global multidisciplinary network of experts from the lung cancer and oncology community that was established in 2021, and together we aim to make lung cancer a global policy priority. To date, the network has 118 members and 37 member organisations from across the global lung cancer community, including I-ELCAP, who provide their time for free, as well as 10 funding partners. And our membership encompasses a variety of different backgrounds and expertise, including clinicians, academics, patients, patient advocates, and currently spans 38 countries, with the hope for more. So over the past 5 years, through our research, analysis, consensus building, and policy engagement, the network has helped develop a huge variety of resources across a number of topic areas. We've encouraged the implementation of LDCT screening, supported earlier detection and diagnosis, and advocated for optimal care. And within these topics, we've created evidence-based policy reports, published informative videos, blog posts, policy briefs, and delivered events and webinars on a number of important topics in the lung cancer space. It is important to note that all our outputs are non-promotional, evidence-based, and shaped by all the network members. So today, I've been asked to share some findings on our most recent work on optimising lung cancer diagnosis. This work sought to capture the diagnostic landscape for lung cancer and develop policy recommendations that are globally applicable to improve equity, access and outcomes. So as you all well know, delayed diagnosis is a major contributing factor to widespread poor outcomes and survival in lung cancer, and recent progress in diagnosis, assessment and management is not being fully translated into improvements in outcomes and survival. Inadequate early detection and tobacco control efforts have largely contributed to this, as well as limitations in diagnostic methods and specific techniques, such as their high costs, invasiveness and time-consuming processes. As a result, most people still are diagnosed at a late stage, and at this stage, obviously curative treatment is less feasible, chances of survival are lower, and clinical management is more complex, which contributes to higher healthcare costs. I think it's also important to note that lung cancer is an inequitable disease, with the differences in survival associated with location, sex, socioeconomic position, while other biological and demographic factors add to this complexity. But crucially, accurate diagnosis offers a way to ensure these disparities are not exacerbated through suboptimal care, but widespread gaps in access to diagnostic and testing and innovations reduce diagnostic accuracy, delay detection, and contribute to these long-observed inequalities in outcomes. For example, biomarker testing rates have increased globally in recent years, but these vary widely between countries, and barriers to access are quite widespread. It's therefore quite clear that a comprehensive approach to diagnosis must be recognised as a critical component of lung cancer care and reflected in policy and practice across health systems. The diagnostic pathway is represented on the slide, and as the pathway starts from a person's first interaction with a healthcare professional all the way through to confirmation of a disease or condition, optimisation should not be limited to the exact moment a person is diagnosed. There are a variety of opportunities to optimise care before, during and after diagnosis, and these are increasing as the diagnostic landscape evolves. So with advances in molecular understanding of the disease and the rise of biomarker testing, more comprehensive and accurate diagnoses are possible. And with this in mind, policymakers are increasingly recognising the value of efficient diagnostic processes, but more work really is needed to translate this into local strategies. For example, lung health has recently raised a policy priority at the global level with the World Health Assembly resolution on integrated lung diseases earlier in summer last year, as well as regional and national commitments to improving lung cancer diagnosis. So to ensure appropriate allocation of resources and high quality care delivery, national strategies must reflect the latest evidence, outline priorities for diagnosis, and be accompanied by appropriate funding models. With this in mind, it's clear that optimising diagnosis requires a multidisciplinary and multifactorial approach to lessen the impact of the disease on people, health systems and society. Last year, the network published a report that provides recommended actions for health system leaders and decision makers to optimise lung cancer diagnosis, with the network emphasising that this should include streamlining all phases of the diagnostic process. Please do go to our website to access these recommendations, as well as sub-recommendations made based on the evidence and consensus among the network. So, thank you so much. Oh, I'm going the wrong way. Thank you so much.